Happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
And Dr. Brian Ostick, we have our game show beginning today.
Yes, we will be talking today specifically about the cost of healthcare and why and how direct primary care is really positioned to transform the way we deliver and pay for healthcare in our country. And it really jazzes me up. I'm on doing a 2-day virtual conference right now with all of my DPC colleagues across the country. And it's just kind of what I needed to fill my cup to inspire myself and us in our office, in our practice, to get the message out there that DPC is much more than your typical concierge model. It's really about price transparency, delivering affordable, accessible primary care to all of those in the community. Anyway.
But that's great, Dr. Ostick.
Yeah,
but
before we do that,
people want to know who won the $100 gift certificate to a local restaurant.
Right.
So let's do it. Anybody who commented on the last video that we did last week was put in the wheel of names here, and Dr. Ostick is going to spin it, and we're going to pick our winner. Now, just so you know, there is nobody on this wheel that is related to either of us.
Right.
Because there was some family comments.
Right, there were a lot of family
George
members.
Packer the fourth.
Yes.
You are
Paul
ineligible.
Ostick, ineligible.
Paul Ostick, ineligible.
Yes.
So, and nobody that works here. You can't be an employee.
Correct.
Anna Maria.
Sorry, Anna. So here we go.
Let's do it. Here, this is official. Everybody that commented is in there. That's
just
not
click the center.
excluded. And just click on it. Yeah, let's see who it is. Oh my gosh. I'm so excited.
Ooh, Angela Burton.
Angela Burton, we have a winner.
She's a local mom. We will definitely reach out to you, Angela.
We'll reach out to you and get you your gift certificate.
Gift certificate to a local restaurant of your choice to help support our local restaurant and bars, especially in our local community, to lift them up during this hard time.
All right, tell me about what is wrong with healthcare.
What was really inspiring, I think, that started off this summit was the keynote speaker was Dr. Marty Makary, who wrote the one amazing book called The Price We Pay, which really exposes the pitfalls and how we are absolutely bankrupting patients and people in our country with inflated healthcare costs and surprise billing. So if any of you are interested in really learning about that, it's a really great book. I encourage everybody to read it, especially if you're in healthcare.
He's also a Jeff guy.
He's also a Jefferson guy. So if you're listening, you're a medical student, you're a PA student, you're kind of just starting your career in healthcare, you're a nursing student, you've got to read The Price We Pay. I mean, we've got to also understand it's not just about medicine, but it's about the delivery model that we've found ourselves in here in the country and how broken it is. And he makes so as a keynote speaker, he makes a great analogy to the airline industry and how when we go to click, to select a flight, we know the time, the date, and the price of that ticket. It's built in, it's fixed, it's transparent. If we had, we're often compared to the airline industry and medicine, right?
Whether that's good or bad. There's some good parts about it, and probably some bad parts about it.
Efficiency and standards of care and algorithms. So if we take that modeling of healthcare and apply it to the airline industry and you say, actually, we're not going to tell you the price, you're just going to book your flight and you're going to get a bill later. And that pilot, let's say they had a really complicated flight and there was a lot of turbulence and they were able to, charge more for that flight. Right. There would be an outrage.
And price gouging.
And price gouging, which is where we land ourselves here with our healthcare industry. Finding patients, 50% of people filing for bankruptcy do it for expensive medical bills. And so the people we are causing fiduciary harm to our patients. So
I bet you have no idea if you had to go to the ER today what it would cost you.
Absolutely.
And as an ER doctor,
you couldn't tell your patients.
Somebody asked me, what is this going to cost me? I just said, I have no idea. No idea. I'll let the financial team explain how this whole thing works, and you still won't know.
And what a lot of CEOs of hospitals will say is, well, nobody's really expected to pay that price. I mean, it's kind of a fake price. But guess what? They do. They get those bills. And there are hospital systems across the country that will even take these patients to court to garnish their wages to get their to get the money from them for their inflated hospital bills.
Now, there are other hospitals that will work with you if you're having trouble
Right.
paying. But I think that when it comes down to it, it's price transparency is not there in
No.
the medical industry where it is in the airline industry.
Right.
Like, down to the penny, how much it's going to cost you to fly from LAX to PHL, which is Philadelphia.
Correct. And, there's such disparity even within the same city. In Boston, it could cost anywhere between $7,000 and $31,000 to deliver a baby. And there's no way for a patient or a person to know, going into it, how much it's going to cost and what they're on the hook for. And a lot of these patients that do end up filing for bankruptcy because of expensive medical bills and surprise billing, a lot of them are insured. Yeah. It's not a matter of uninsured or being insured or not insured. Insurance being covered does not mean you have great access to care. And it does not mean that you are, exempt from being hit with surprise medical bills. Right. So direct primary care is in such an incredible position to really transform this conversation about how we pay for medical care in this country.
That's the punchline right there.
Right there.
Like,
not only do we have a smaller practice model and we have relationship-based clinics, which I love that phrase. I mean, we know our patients through and through, and we could make individualized medical decisions, talk about preventative health, talk about nutrition, talk about all these chronic diseases that we see in the end stages cost a lot of money to our healthcare system, but we are launched in this position to get them earlier and talk to patients about how they can redirect and prevent a lot of these catastrophic medical disease states.
Well, and specifically coming down to your practice, people have price transparency with Health and Healing Direct Primary Care. If you're an adult in this practice, you're going to pay $89 a month.
That's it.
Flat fee. That's going to happen at the beginning of the month, every month, or whatever day you want it to come out of your paycheck.
Right. Whether you're here 25 times a month or calling me all the time, or you're here once a year for your physical, that's how much it costs. You don't see any other bills from me. The other thing that we really painstakingly, put a lot of energy into is making sure we have transparent lab prices. So when I say we're going to check a CBC today or a urinalysis, I can tell you it's $3 for the CBC, it's $6 for the urinalysis. That's what I have.
Down to the penny.
Down to the penny, $6.03 actually. Mm-hmm. So that's what it costs. And when you bill insurance and you just throw it to the wind, a lot of times, you're paying 20 up to 80 times the amount it actually costs for that same lab test
and
done
your practice,
by the same
let's be
lab.
Clear, people don't understand this. Your business here does not bill insurance at all.
We don't bill insurance for anything, and we've taken third-party payers out of the mix, and it's not just because it's a hassle factor, because it is a hassle factor. It's because they're doing more harm than they are, than good for the patient and for the practice. It's more they are the ones that are, negotiating with contracts and paying, causing the rates of cost of medical care to go up.
Same thing with radiology. If I come to you and I have lower back pain and we decide that, gosh, I need to get an MRI of my lower back to figure out what's going on. If I go to the hospital to get that, they're going to say, oh, it's $2,000, but then we're going to bill insurance, and eventually it's going to turn out to be some random number.
Right.
But with you have direct pricing with the radiology group, so again, down to the penny, how much that's going to cost the patient before they go get their MRI. So there's price transparency.
There's price transparency. It's one image. There's really not a whole lot of extra complexity that goes into it. You're paying MRI with or without contrast, $325 to $350, and that's what we need in first and foremost. We need to know what we're dealing with. We need fixed price transparency with these types of elective procedures, especially in low cost medical utilization, so that we can know what we're dealing with. Right now, we're using insurance to pay for predictable small little things, which drives up the premiums every year. So now it becomes even more inaccessible for patients to access. We don't use car insurance to change our windshield wipers, right? We shouldn't, right? It's only going to drive up the premiums the next year. So we shouldn't be using healthcare insurance to pay for things like a urinalysis or, a primary care visit or an x-ray. I mean, those are very low cost, fixed, predictable types of prices and procedures that we can cover through a good healthcare system and really a competitive market.
So if you want price transparency in your medical care, if you want low cost but amazing healthcare, I mean, I think the answer is Health and Healing Direct Primary Care.
Relationship-based clinic. That's what we are. That's my new motto, I love that. I love all of my patients. I know them through and through. And that's what I think they feel like they're missing too in the kind of rat race of primary care that it's become in some of these larger clinics. So
I can see it on your wall right now.
Relationship-based care.
Yeah.
I'm going to have my mom make that.
That sounds awesome.
We're here for you. Call us 818-600-2426. We are filling up, so we'll be starting a wait list soon. But if you need anything, want to know more about the model of direct primary care, I'm always happy to talk with you. Obviously, you can see I'm very passionate. You can visit us on www.healthandhealingdpc.com. And we hope you all stay really healthy and safe through this pandemic. And
Smash that like button.
button.
Smash
Take care. Bye.